Hi, I'm Becky Annunzio, and the encyclopedia topic I chose is rheumatoid arthritis. I chose this topic because it's personal to me. I was diagnosed with RA about 6 years ago. Have you heard of or know someone who's been diagnosed with rheumatoid arthritis? What do you know about it? It's just regular arthritis, right? Nope, it is definitely not regular arthritis. Rheumatoid arthritis is an autoimmune disorder. This means that the immune system attacks the person itself. In particular, with rheumatoid arthritis, it attacks the person's own tissues, particularly the joints. It can cause pain, swelling, and discomfort in any joint, but it's most common in the hands, wrists, and feet. It can also cause issues with other parts of the body, such as the eyes, the mouth, or the lungs. So what should you look for? Pain, swelling, tenderness, and inflammation in more than one joint. It will also typically occur bilaterally, meaning that you will experience symptoms on both sides of the body. People with RA often experience weakness, especially in their hands or their grip, unexplained fatigue or tiredness, and some even experience weight loss and fever. But who's at increased risk? Rheumatoid arthritis cases are 2 to 3 times higher in women, so women are definitely at increased risk. In particular, older women, but you can get RA at any age. There tends to be a genetic component to RA, in particular, those with the human leukocyte antigen genotype. Those who smoke or are obese are also at increased risk for rheumatoid arthritis. There is also an increase for those who experience secondhand smoke growing up. There is no known cause for rheumatoid arthritis, but there are things a person can do that may help to prevent rheumatoid arthritis. Smoking and exposure to secondhand smoke is a major risk factor for RA. So stopping smoking may help more than just your lungs. I think it'll be interesting to see if there is a reduction of rheumatoid arthritis diagnosis now that smoking is not prevalent in society as it once was. Do you think we'll see fewer cases? Do you think vaping will impact rheumatoid arthritis at the same level that conventional combustible cigarettes do? I guess we'll have to wait and see. Another thing that can be done is increasing specific micronutrients. Increasing vitamin D and calcium may help minimize bone loss. Omega-3 fatty acids and vitamin A are also helpful to fight inflammation. So eating fish or taking a fish oil supplement may be helpful also. Finally, maintaining a healthy weight and staying active with low impact activities are recommended for all chronic disease prevention, including bone health. Reducing exposure to environmental pollutants are shown as they are shown to have a negative effect on the HLA gene. Rheumatoid arthritis is diagnosed using a number of methods. First, tests will include a physical examination of the joint with special attention paid to those that seem affected. The doctor will check for swelling, inflammation, or warmth in the joints. Lab tests are typically also ordered. People with RA often have erythrocyte sedimentation rate, or ESR, or C-reactive protein, CPR levels, which may indicate the presence of inflammatory processes in the body. Another common test looks for rheumatoid factor. X-rays are used to help monitor and track the progression of disease. Many doctors also use ultrasounds of the hands and the feet to determine the severity of the disease within an individual. Treatment for RA usually includes a variety of methods and varies from person to person. The next slides will cover many of the treatment methods a RA sufferer may opt to do. Depending on the severity of the disease, there are several medications that a doctor may prescribe to treat RA. Non-steroidal anti-inflammatory drugs, such as Advil or Aleve, can reduce pain and inflammation. There are stronger prescription options that can be prescribed. Corticosteroids, such as prednisone, reduce inflammation and slow joint damage. These are often used for quick relief of a sudden onset of pain and inflammation, commonly known as a flare-up. Conventional DMARDs, such as methotrexate or Plaquenil, can slow the progression of the disease and save the joints and other tissues. Biologic response modifiers or biologic agents, such as Humira or Enbrel, are often paired with methotrexate when recommended. It tends to increase the effectiveness if it isn't already as effective as the doctor would like. Targeted synthetic DMARDs, such as Rinvoq or Xeljanz, may be used when one of the aforementioned medications seems to be ineffective. Additional lab tests may be required, as some of these medications can cause kidney or liver problems and damage. Many of these medications are injectables, meaning they have to be injected. If you were diagnosed with rheumatoid arthritis, do you think you'd be able to give yourself a weekly injection? If not, do you know who would be able to help you do that? Because oftentimes they're administered at home and not in the doctor's office. So people with rheumatoid arthritis may need additional support from friends or loved ones. There are many methods one can use to help manage the symptoms and emotions that come with rheumatoid arthritis. Consulting with a physical or occupational therapist can provide information on movements and strategies to make everyday tasks easier on the joints. Many use alternative medicine and strategies to make everyday tasks easier on the joints. Alternative medicines can also help with rheumatoid arthritis. Acupuncture, herbal medicines, and massage therapy all provide relief for some pain associated with RA. Assistive devices, such as tools to help open jars or modified handles on knives or other tools, will help with everyday movements and tasks. Using heat or ice to treat areas of inflammation or pain can help soothe irritated joints and reduce swelling and pain in a particular area or joint. Making sure you keep your joints flexible and supported is important to treat rheumatoid arthritis. Low impact aerobic exercise is recommended for all, whether you have arthritis or not. Many people also engage in strength training to build muscle around the joints to increase support for particular joints. Engaging in flexibility exercises can also help maintain the range of motion. There are many recommendations about food and diet. There are many diet and recipe books out there that can help a person with rheumatoid arthritis identify and avoid inflammation-causing foods. Fix It with Food by world-renowned chef and autoimmune disease sufferer Michael Simon is just one of the many. Rheumatologists also suggest adding vitamins A and D, calcium, fish oil, and turmeric supplements to your daily routine. Vitamin D and calcium promote bone health and density. Turmeric is shown to reduce inflammation, as are vitamin A and fish oil. These supplements provide many other health benefits outside just combating rheumatoid arthritis. Most people never need surgery, but for some, as a last resort, if medications cannot prevent severe joint damage, surgery may be recommended. Synovectomy removes the inflamed lining of the joint and can help reduce pain and improve the joint's flexibility. Tendons may become loose or rupture, needing repair. Joints may need to be fused together if the joint cannot be repaired or replaced, or it may be necessary to replace the entire joint with a prosthetic joint made of metal or plastics. In addition to maintaining good physical health, it is important to find ways to care for emotional health too. Finding a rheumatologist you like and trust is important. Therapy, exercise, and finding support groups can help manage the stress and uncertainty of the disease and prognosis. Invisible disorders such as rheumatoid arthritis can be very isolating, as many people do not understand how the affected person feels or the type of pain they may be in. They often try to compare it to their joint pain or their osteoarthritis. User-generated platforms are a great source of information and support as they bring together a community of individuals that have greater understanding. It's a great way to share information about treatment, triggers, and practices that one may engage in that could reduce discomfort and pain. Anyone can be diagnosed with rheumatoid arthritis, but the typical age of onset is between the ages of 25 and 45, and it affects women disproportionately. Over 1.5 million US citizens have been diagnosed with rheumatoid arthritis. Early diagnosis is crucial. It can affect the outlook a person may have. It is also important that the treatment regimen begins quickly to reduce the potential for further tissue damage. Treatment in younger people may be different than in older people, as comorbidities or other medications may impact the treatment options due to prescription interactions. Elderly onset rheumatoid arthritis can be particularly concerning, as there is already a potential for increased falls. Rheumatoid arthritis only magnifies that issue. There is also the possibility that the person may have life-altering decrease in function, impacting the ability to perform routine daily tasks or personal care tasks, requiring additional supports from nurses, caretakers, or loved ones. There is an association with elderly onset rheumatoid arthritis and menopause, possibly due to the change in hormones. You know yourself best. Make sure you're paying attention to any changes in your body. Don't ignore signs and symptoms of disease, as it prevents early detection and treatment. Find doctors and specialists you trust and feel you can have open and honest conversations with. Ones that are willing to listen to your questions and concerns and take the time to explain all of your health options.